idea. I am so smart, suddenly it just appeared. There's a light above my head, sometimes white and sometimes red. Bright ideas make it glow, and very soon the rest of the world will know. I just came up with a really bright idea. I am so smart, suddenly it just appeared. I just came up with another bright idea. I am so smart, suddenly it just appeared. There's a light above my head, sometimes white and sometimes red. Bright ideas make it glow. And
Hello. Good morning / afternoon, everybody. How are y'all doing? Were you all singing along to that song like I was? It's such a catchy tune, and I just love it. We got to give credit to our wonderful Miss Rochelle for making that lovely video. And we're going to go ahead and get started. Guess what? We are on week 8. So how many weeks have you all been with us? Everybody that's here today, go ahead and type in the chat. Have you been with us every single week, or did you just discover that we are putting out these YouTube videos every Wednesday? Let us know in the chat. This week we are going to be covering anesthesia and radiology, so I hope you're ready for a great class. And just to let you all know that we will have a winner. We've been announcing winners throughout some of our weeks for a lecture series. So the next winner is going to be announced at the end of week 10, okay? And some of you are asking for more information. And so for the ones, I know you're probably saying I talk about this every single week, but there's some students that aren't with us every single week, so I just want to let you know so you aren't missing out on anything. If you are looking for more information on what AMCI offers, then we do have a lecture series and a fast track course. That's a couple of the courses that we do offer here at AMCI. So you just have to visit us at www.amcicoding.com, click on that tab that says courses. Little drop down menu will appear, and click on lecture and fast track courses. These are both monthly subscriptions, okay? So you have your lecture series there, and with your fast track you get a little bit more, okay? A little bit more bang for your buck there. And again, those are monthly subscriptions. All right, and I would love to introduce the wonderful team that is joining us today. Aside from our assistant instructors who are here in the chat standing by, go ahead and say hello to Miss Anna in our chat over here. We have Miss Sarah, Miss Angela, Miss Valentina, Miss Tiffany, Miss Tamika. You never know who's going to be stopping by. So go ahead and say hello to all of our instructors there. And joining us today for the instructional piece, I'm Mrs. Tracy. I'm one of the instructors here at AMCI. And joining us today, we have the wonderful Miss Rochelle. She is our Partnership and Marketing Director here at AMCI and one of our lovely instructors. So hi, Miss Rochelle, how are you?
Hello, Miss Tracy. I'm doing great. How are you? How was your weekend?
It was wonderful. Thank you, Miss Rochelle. How about you?
Oh, it was great, actually. And I cannot wait. It's already Wednesday. Wow. Happy hump day. And hello, team. And most of all, hello, coders. How are you? We're back here again. And I think this is probably one of our most requested sections to cover. So we brought in a really great class for you today. Hang on tight because we're going to be solving anesthesia and radiology and learn all about those guidelines. So I'm ready, Miss Tracy, and thank you so much for the introduction.
Awesome, awesome. Okay, and last and certainly never least, we have our outstanding curriculum director here over here at AMCI. She's also one of our instructors. Hi, Mrs. J. How are you doing today?
I am well. How are you, Mrs. Tracy?
I can't complain, Mrs. J. I'm doing great.
Well, that's awesome. I know you asked everyone if they were singing that song. Well, I have to admit, I'm over here dancing to the song. So, whatever floats your boat, just do it. I think it's my turn to take the screen. And I just want to say hello, coders. How are you? Hello, team. How are you? And I'm talking about the instructional team in the chat. You all know who you are. Miss Sarah, Miss Valentina, Miss Tiffany, Miss Tamika, and Mrs. Tracy's laughing at me. What'd I do, Miss Tracy? You know what? I'm sitting here trying to figure out how to get this screen back where it needs to go.
I'm just that song is still stuck in my head, but I love it. It's such a catchy tune.
Yeah. I'm trying to get onto the screen, so give me a moment. I'm going to do it.
Sure.
It's coming. It's coming. I think my computer's just a little slow. But here we go. Not yet. I changed some features on my computer and it's giving me a hard time right now. Okay, I'm back. Here's my screen. All right, coders. Thank you, Mrs. Tracy. Thank you, Ms. Rochelle. Are you all ready? Do you want to win an AMCI lecture series? Well, here's what you do. Well, wait, you want to know what a lecture series is? Well, let me tell you. Lecture series, AMCI lecture series is our private lecture series. This is what our students watch. Though our private students, they watch it all. They have the key to everything. Yes, these lectures that we're doing here, this is our great stuff too, but the stuff that is in our classes, that's our greatest stuff. If you want to be a lecture series winner, go ahead, comment on this lecture below. Below the description, go ahead and comment. Tell us what you learned today. And there's a link in the description. Click on that link and register for the drawing, and we will announce the winner during week 10. So that's in 2 weeks. So come back each week and go ahead and enter yourself in the drawing. Yeah. All right. Now we have a hand poll that we do every week. Can you guess what the poll question is? Go ahead and type it in the chat. And if you come every week, you probably were going to say, how confident are you with guidelines? Not today, not today. I have a new question. And this question is, how many of you annotate your CPT manuals? How do you annotate your CPT manuals? And if you do annotate it, do you use Chun? All right, that's the question. And while you're answering that question, I'm going to talk to you about the class rules. Remember, this is an advanced class and it is accelerated, meaning we're going to move at a faster pace. Now, if you're currently in a comprehensive course already, this class may be for you. If you already have your certification, this class is definitely for you. It's a great refresher. And remember, you can watch the playbacks anytime, and we have homework. Homework is available in the description section for 24 hours. And remember, students should already have some experience with CPT guidelines because class will move at a faster pace than usual. Okay, coders, the goals for today, what are they? Number one, we're going to review guidelines for anesthesia and radiology section of the CPT manual. Number two, provide scenarios to further clarify the more complex guidelines. Number 3, we're going to give you some CPT documentation tips. Yeah, that will be Chun. And 4, we're going to demonstrate the importance of forensic reading. What is forensic reading? Why, that's reading very carefully, and that's what we do at AMCI. And again, coders, class will move at a faster pace than usual. All right, course outline. Number 1, integumentary. During our week 1, we reviewed integumentary system guidelines. Week 2, the musculoskeletal system. Week 3, respiratory. 4, cardiovascular. Week 5, digestive. Week 6, urinary male-female. Week 7, nervous eye, ear. And this week, week 8, radiology, anesthesia. Really excited about that. And then don't forget, come on back next week. We're going to discuss pathology and lab. And our final week, week 10, we're going to end it with medicine. So that's a lot of information, but we will not cover the following. We will not cover evaluation and management, ICD-10-CM, or PCS. Those topics are so comprehensive that we just don't have enough time to do it. Now, if you join our lecture series, you will get comprehensive instruction on evaluation and management and ICD-10-CM and PCS, but class will move at a faster pace than usual. Now, if you're waiting on the drawing to win the lecture series, and let's say you don't want to wait, you can go ahead and sign up for the course. There's a link in the description box, and there's also a coupon. Yeah, 10% off coupon. All right, so just want to remind you that if you have a question, make sure that you type your question in the chat box. Keep in mind that the instructor speaking, and that instructor right now is me. I cannot see your questions. However, the AMCI instructors who are not speaking, they're standing by to answer your questions, and you can identify them by their icon. It's a teacher icon and the title that says AMCI instructor. And there are a few that don't have that title, but you can tell Miss Abby, she doesn't have that title, but she's indeed an AMCI team member. But the names will read AMCI instructor Mrs. J, AMCI instructor Ms. Rochelle, or AMCI instructor Mrs. Tracy, and so forth. Now, although I'm speaking right now, but when I finish, I'm going to come in the chat and join you. So if you have a question for me, just click the @ and my name, and it'll come directly to me. All right, let's review the copyright. CPT is copyright of the 2019 American Medical Association. All rights are reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC, keyword concept, FTR, Chun, AMCI Fab 7, Flip Tap are all trademarks of AMCI. All right, look at this. We have a little malfunction on the screen, but it's okay. Now let's talk about guidelines. Guidelines, that is the subject. That's why we're here. All right, so there are 3 types of guidelines when coding in the radiology section. The first type of guidelines are your parenthetical guidelines. You'll find these guidelines in parentheses, like right here in this section. The second are your code series or chapter guidelines. You'll find them below the chapter, below that blue heading. And the third are your general coding guidelines, and you'll find them at the green pages. There you go. So today we're going to talk about radiology guidelines. And if there is no guideline, keywords rule, you trust those keywords, but honestly, your guidelines reign supreme. Remember, parenthetical in terms of hierarchy, parenthetical is the highest ranking, followed by your code series, followed by your general coding guidelines, and that is how you need to consider your scenarios. All right, if you like our instruction today, please like this video. Like this because this will become a YouTube video, and you can like it right now if you want to. And make sure that you tell everyone about us. Tell as many people as you can about us, because the more people watch, the more videos we will make, and that is a promise. And if you want to know how to like us, just look at the screen right here in this section. You just click on it and it will like it up. And don't forget to subscribe. If you subscribe, you will get notified every time we upload new content. So go ahead, like, subscribe, and share this channel or this video for that matter. All right, so I'm finished. I'm finished talking about this, and I think we've already had our poll. So let's get to it. You all ready to talk about anesthesia? Well, I am. So what do we know about anesthesia? Well, we know that there are a few types of anesthesia, and when you're coding for anesthesia, you're in CPT, in the anesthesia section, you're coding for the administration of general anesthesia and blocks. Okay? So, general anesthesia is a medically induced coma with loss of protective reflexes. And this is resulting from administration of one or more general anesthetic agents. I know my mom she had a procedure just recently, and it was brought to my attention that they administered propofol as well as anesthesia through an IV. So I'm not quite sure the two that were used, but this is a classic case, an example where there are one or more general anesthetic agents used. Now, according to the American Society of Anesthesia, that's the ASA, a medically induced coma occurs when a patient receives a controlled dose of anesthetic. Okay, and typically that's propofol or pentobarbital or thiopental, and they administer this to cause a temporary coma. So when people are, when you hear that someone was in a medically induced coma, it is the anesthesiologist that does it, and it's the same context as general anesthesia for a procedure. Isn't that interesting? All right, so if you want, you can go ahead and read, Google the American Society of Anesthesiologists. They have a report on medically induced coma, particularly 2011. It's a great read. All right, so let's talk. Oh, also, I said these nerve blocks. A nerve block or a regional nerve block is a deliberate interruption of signals traveling along a nerve, often for the purpose of pain relief. So these anesthesia codes are used for the administration of general anesthesia and blocks, nerve blocks or regional blocks. Now let's get to the business and let's look at the table of contents of these guidelines. Well, at the top, you see that there's time reporting, really important. You may, if you're still studying for your exam, you will 9 times out of 10 have to know how to report time. Anesthesia services, supplied materials, and these are the guidelines, okay? This is where you will get the instruction, and I believe, we will review A lot of this. All right, so separate or multiple procedures, there are guidelines. You've got unlisted services or procedures, special reports, anesthesia modifiers, physical status modifiers, and qualifying circumstance modifier. All of the guidelines can be found on pages 60 and 61. And then you'll find your codes, and your codes are ranged from superior, that's your head, to inferior, all the way down to your lower extremities. And then you've got some radiological procedures, some burn, excisions or debridements, obstetric, and other procedures right here. So not a lot of pages. Look at this. You've got pages 60 to 69, inclusive of your guidelines and all of the procedures. So that's good to know. So let's look at some of these anesthesia guidelines. Now, we're not going to talk about the guidelines surrounding time. Let's just talk about the anesthesia modifiers, physical status modifiers, and qualifying circumstances, and how to notate your anesthesia section. All right, so we're going to start by talking about physical status modifiers. Your physical status modifiers are these are represented by the initial letter P, like right here, P1, P2, P3, all the way down to P6. Now, these indicate the status, the physical status of the patient at the time of the anesthesia encounter. So if it's a normal patient, P1 will be assigned. If the patient has mild systemic disease, P2. What's mild systemic disease? Hypertension that's controlled. All right. P3, a patient with severe systemic disease. That could be hypertension that's not controlled. P4, a patient with severe systemic disease that is a constant threat to life. That could be CKD or multiple systemic diseases. Okay. P5, a moribund patient who's not expected to survive without the operation. This P5 could be a patient who has cancer and they have to have an excision. P6, a declared brain dead patient whose organs are being removed for donor purposes. So that's why they're keeping the patient alive, just for the organ. All right, so these physical status modifiers, they have values. So if you have to calculate certain things on your exam, and you're going to learn those a little later, very, very soon, you will need to know these values, especially if the documentation doesn't provide them. So just for a record, P1, the value is 0. P2, that value is 0. P3, the value is 1. P4 is 2. P5 is 3. And P6 is 0. Now, make sure, if I were you, I would make these same notations. I certainly would. All right, so the next topic will be qualifying circumstances. So what is a qualifying circumstance? Well, this is a service that's rendered, an anesthesia service that's rendered under a difficult circumstance, and it depends upon the factors. Now, let's take a look at these 4 circumstances. If you have a case where the patient is of extreme age, meaning they're younger than 1, if they're younger than 1 or older than 70, then you would append 99100, because that means that their procedure may be difficult because of their age. And you know what I would do? I would document 11 months and younger and 71 years of age and older. And you know why? Because if the patient's 70 and we see 70 and we're going to say, oh yeah, we can use this. And no, you have to be 71. It's older than 70. And just like the 1-year-old, you have to be younger than 1. Okay, so just so you don't make a mistake, I would put this notation here. And also, if you look in this parenthetical guideline here, there are certain procedures that are performed on infants that younger than 1 at the time of surgery. 00326 561 834 836. There are some guidelines, some parenthetical guidelines at these code levels. And if I were you, I would turn to those pages and I would indicate those guidelines next to those codes so you don't make that mistake. And I believe those guidelines say, don't append 99100 with these codes. That's just a guess, but if I were you, I would. All right, one more thing before we leave 99100. Just want you to know that this value is equal to 1. The next is 99116. This is anesthesia complicated by hypothermia. Means the doctor had to lower the patient's body temperature, and that value is 5. Next, 99135. This is anesthesia complicated by hypothermia. And now hypotension, the doctor lowered the blood pressure, and that value is 5 as well. And finally, 99140, this is emergency conditions. No, it's not the typical emergency room circumstance. It's a circumstance. Emergency is defined as existing when delay in treatment of the patient would lead to a significant increase in the threat to life or body part. So the patient's going to either lose their life or their body part if they are not treated. So that value is 2. All right? And these values are important, and you're going to see why momentarily. Something else you need to document. Every 15 minutes of anesthesia time equals 1 unit. So every 15 minutes equals 1 unit of anesthesia time. All right, so 15 equals 1 unit, 30 is 2 units, 45 is 3 units, 60, 4 units, just so you know. Something else that you need to know is the formula for calculating anesthesia payments. And we're going to review time and payments when we finish this documentation. Here is the formula: base plus time plus modifying factors times the conversion factor that's the formula. All right, there you go. And modifiers. See all these? Yes, these are modifiers. Yes, they're letters, but they are modifiers. And how do we know? Well, we know these are HCPCS level 2 modifiers, and we need to know them because we need to use them when coding for anesthesia cases. AA is anesthesia performed personally by the anesthesiologist. AD, this is a physician or this is a physician who medically supervises 4 or more concurrent procedures. That means there are four procedures going on with anesthesia being administered at the same time. A QK, a qualified individual who provides medical direction of 2, 3, or 4 surgical cases of anesthesia being administered at the same time. Concurrent means the same time. QS, this is a MAC, monitored anesthesia care. QX, CRNA, directed by a physician. So CRNA is certified certified nurse anesthetist directed by a physician. This is the anesthesiologist or surgeon. QY, anesthesiologist directing one CRNA. And QZ, this is a CRNA without direction. All right, so just make sure that your documentation supports use of these modifiers and use of the corrected. So one last thing that I want to tell you, next to the last thing, we have anesthesia related modifiers. These CPT modifiers, these are anesthesia related, and 23 is to be used for unusual procedure, 47 anesthesia by a surgeon, 53 discontinued procedures, 73 discontinued before the anesthesia is administered, 74 is discontinued after the administration of anesthesia. And here are some not coded from the anesthesia section that you need to know. Do not code Swan-Ganz from this section. You code it from the medicine section. Don't code moderate conscious sedation. That's coded from the medicine section. A-line, arterial lines are coded from cardio, and pain injections are coded from the medicine section. And we got some general rules. Anesthesia codes are used for anesthesia, general anesthesia, and blocks. All right. And I think that's it. All right, so now it's time to move on. Let's talk about what we code, what areas are we going to be coding for, and what we're going to be coding when we're taking our certification exams. And we're going to code anesthesia administration, anesthesia time, anesthesia payments to the anesthesiologist or CRNA. Now let's first learn how to calculate anesthesia time. All right, so anesthesia time was 8:21 a.m. and the end time was 11 o'clock a.m. All right, so coders, do you know how to determine when to calculate or what to calculate in the documentation to determine the anesthesia time? If you do, or better yet, let me say it like this. When does anesthesia time begin? Well, according to the guideline, and I believe that's on page 60, I'm just taking a guess, page 60, anesthesia time begins as soon as the anesthesiologist begins preparing the patient in the pre-op period, or even the OR. It just depends. But as soon as that anesthesiologist begins preparing that patient, that's when it begins, and it ends when the anesthesiologist hands over that patient to PACU or recovery. All right. So we've got a situation. Anesthesia time started at 8:21. It ends at 11, and we need to calculate the anesthesia time. And I just want to tell you that the anesthesia time is 2 hours and 39 minutes. So a total of 159 minutes. That's the answer. So how did I arrive at this answer? Well, let me show you. Sorry, I was going to let you solve it, but we got so much to cover today, so I apologize. All right, so this is how I calculated it. I use the Quadrants method because remember earlier I said that every unit of anesthesia time is 15 minutes. So if you use these quadrants, each one equals 15 minutes. So that means a whole quadrant, well, a whole circle with quadrants is an hour. So it's easy for me to calculate. Okay, so let's go ahead and let's use these quadrants. And I'm gonna color them in. Yeah, let's color. All right, so I'm going to change the color because you probably can't see it. So, all right, so 8:21, let's say we begin at 8:21. 8:21 to 9:21 is exactly 1 hour, and that hour, okay, I could never color. That hour includes 1, 2, 3, 4 units of time. So each hour is equal to 4 units of time. The next, I don't think it's going to let me write it. Okay, so the next is 9:21 to 10:21. That's another hour. Let's go ahead and do this, and do this, and do this, and do this. That's 8 units, right? If you count all the color, that's 8. And then you've got 10:21. This one goes 10:21 to 11:21, and we don't need all the way to 11:21, but I'm going to show you how it's done, all right? So let me get off of this. Okay, sorry about that. All right, so let me show you how I do it. Okay, of course I messed up my slide. It's okay. All right. All right, so we know that each quadrant equals 15 minutes, and every 15 minutes equals 1 unit. So 8:21 to 9:21 is 4 units. 9:21 to 10:21 is another 4 units. We know that's 8 units, but it's this 10:21 to 11:21 that gets a little tricky. So let me show you on the next slide how we do it. So we know these two are 8, and that's 2 hours. All right, 2 hours, 8 units equals 2 hours. But it's this last one. So let's take a look. 10:21 to 11:21. All right, let's start counting. 10:21 to 10:26. We're going to count each 15 minutes. Then 10:36 to 10:51. And then this quadrant is 10:51 to 11:06. This is where we stop because 11 o'clock is between 10:51 to 11:06. So let's go ahead and let's count the eligible quadrants. 1, 2, 3. So that equals 3 units. So the 8 units in the 2 quadrants that we've just calculated plus the 3 units equals 11 units. So if the anesthesia time started at 8:21 and ended at 11 a.m., that shall be 11 anesthesia units of time, or anesthesia time units. Now, somebody might say, Mrs. J, there's an easier way to do it. You better believe it is. Even though there's an easier way, I like the quadrants because that's the way I learned first. But here's the even easier way. You could just calculate the number of minutes. So 2 hours and 39 minutes equals 159 minutes. And then all you have to do is divide 159 minutes by 15. Remember, 15, every 15 minutes is 1 unit. So you divide it by 15, and your answer is 10.6. And then you take that 10.6, you round it up because it's higher than 5. So you round it up to 11, and the answer is 11 units of time. How did you do, coders? You do okay? So this is how you calculate anesthesia time. Now, another thing that we have to know how to calculate is the anesthesia payment. Yes. So In order to calculate the anesthesia payment, you have to know how to calculate the anesthesia units of time. You have to know how to do that. And you're also going to need to know the following. You're going to need to know what the base is. What is the base units? And this is provided by ASA, Anesthesia Society of America. Number two, you're also going to need the time, like we just did. It's calculated every 15 minutes. Every 15 minutes of anesthesia used, that equals 1 unit of anesthesia time. Also, you're going to need to know the physical status modifiers and the qualifying circumstance, those values that I just gave you earlier. You're also going to need to know the conversion factor, and that's provided by CMS. So as you can see, this is looking like this is very doable. The only thing you really have to figure out is your time, and here is the formula. You're going to have to add the base plus the time plus your physical status modifiers and your qualifying circumstance modifier values. And when you add that all up, you take that result and you multiply it by the conversion factor, and that's provided. All right? So if you want to take a picture of this, because this is the formula for how to calculate an anesthesia payment, go right ahead. And you know what, coders? It's now time to solve our first scenario. I'll read the answers first. A, $800. B, $900. C, 1,000. D, 1,200. Code 00940, anesthesia for vaginal procedures, has a base value of 3 units. The patient was admitted under emergency circumstances. Qualifying circumstances code 99140, which allows 2 extra base units. A pre-anesthesia assessment was performed and signed at 2 a.m. Anesthesia start time is reported as 2:21 a.m. and the surgery began at 2:28. The surgery finished at 3:25 a.m. and the patient was turned over to PACU at 3:36 a.m., which was reported at the end of the anesthesia time. Using 15-minute time increments and a conversion factor of $100, what is the correct anesthesia charge? Okay, coders, I'm going to give you a minute and a half. Okay, coders, how did you do? Did you get the answer correct? I know some of you did. All right. let's go ahead and let's solve it. No, I didn't give you the answer right then, but let's go ahead and solve it. First, let's highlight our keywords. The base value is 3. Emergency circumstances, and that qualifying circumstance code is 99140, and that gives you 2 extra base units. That's excellent. They gave us the units. And then you have your anesthesia start time of 2:21 a.m., and then the patient was turned over to PACU at 3:36 a.m. And the next thing I'm going to do is I'm going to put my formula right here on my screen. The formula is base plus time plus modifying factors times the conversion factor. All right, so what is the base? Because we have to put our numbers in our formula. So the base is a 3. Yeah. What is the time? Now this is where we have to do some work. Let's go ahead and let's calculate the time. Remember I said on page 60, they tell you that the anesthesia start time begins when the anesthesiologist begins. So the anesthesia start time is at 2:21. They tell us straight away, and it ends when the patient is no longer in the care of the anesthesiologist. And that happens when the anesthesiologist turns over the patient. This patient was turned over to PACU at 3:36. All right, so here are my quadrants. 2:21 a.m. to 3:36 will give you 2:21 to 3:21. That's 1 hour. Okay, that's 4 units every 15 minutes equals 1 hour. So we know this is 1 hour and this is 4 units of 15. And we've got another hour to deal with. Yeah, we got another quadrant to deal with. And there you go, 3:21 to 3:36. That is the end time, and that is just 1 unit. So the first 2:21 to 3:21 gives you 4 units. 3:21 to 3:36 gives you 1 unit, and a total of 5 units of time. So we're going to plug our 5 right here where the time is. Next, qualifying circumstances. What is the qualifying circumstance? Well, it says we have 2 units, and we're going to put that 2 right here. And finally, what is the conversion factor? Right here, it says that the conversion factor is 100. Okay, I didn't highlight it, so there it is, 100. Now, coders, let's do the math. Base plus time plus the modifying factors times the conversion factor. Let's do our base plus time plus qualifying factors, and that equals 10. Yeah, so it's 10, and you multiply it by the conversion factor, and that's 100, and our answer is 1,000. So coders, if you said C, outstanding. All right, so it looks like some of you really getting this, if not all of you. I can't see you, and you know what? If you learned something, that is priceless. So great job, everyone. And let's further test our skill by the Anesthesia Coding Challenge. Mrs. Tracy, take it away.
Thank you, thank you. Wow, what a wonderful discussion on anesthesia. I always love the way you break that down, Mrs. J. I hope we all learned something. I know I did. I always do every time I hear Mrs. J teach. So thank you again for that, Mrs. J. And yes, coders, I have a few coding scenarios for you on the anesthesia section. So I hope you're ready. Let's go ahead and get started with our first one here. Our answers are A, 00404, B, 00402, C, 00406, or D, 00400. A 54-year-old female had a left subcutaneous mastectomy for cancer. She now returns for reconstruction, which is done with a single tram flap. Right mastopexy is done for asymmetry. Code the anesthesia for this procedure. All right, I will give you a minute and a half, and your time begins now. Good luck, coders. All right, everybody, get your answers in. How'd you do? Okay, so let's go ahead and reveal the answer on this one. Okay, and if I look at my codes there, it looks like they're all close together, and they're coming from the anesthesia section. Okay, I could tell by those, the first character there of 0, and our answer is going to be B. Okay, so our keywords for this is 54-year-old, mastectomy, cancer, reconstruction, single tram flap, mastopexy, and we're coding the anesthesia for this procedure. So if we look at our codes here, they are all very close together. So they're all within the same family, right? And if we look at the parent code there, 00400, that is for anesthesia for procedures on the integumentary system. So remember your breast when we were going through our integ section? These are, you can find your procedures on the breast located in the integumentary system, okay? So this 00400, I like that so far because it's saying integumentary system. We are on the right system here. However, this says for a procedure not otherwise specified, okay? And we do have a code that further specifies what happened here, okay? We would only use this code if it's not specifying the exact procedure that was performed. And in this case, we do have a code that's going to match that. So 00400 we would get rid of, okay? But we're still going to use that parent language for anesthesia procedures on the integ system, okay? Now, if we go down to 00404, this says it's for radical or modified radical procedures on the breast. Okay, so I don't see anything about mentioning about that. I do just see that some reconstruction procedure is done, not a ratified or modified radical procedure. So I'm going to go ahead and get rid of answer A. And then the same with answer C, 00406, that says for radical or modified radical procedures on breast with internal mammary node dissection. So that's going a little bit further into something else that did not happen here, okay? So we're going to go ahead and get rid of answer C. Now going to the correct answer, this is our reconstructive procedure on the breast, okay? So for example, a reduction or augmentation mammoplasty and muscle flaps. So if you didn't know, that single tram flap there, that actually is a muscle flap, okay? So that stands for transverse rectus abdominis myocutaneous flap, okay? And that's basically the lower abdominal muscle. And that's basically a layered piece of tissue that consists of skin, muscle, and fat. And it's taken from the abdomen of a woman and used in the reconstruction of her breast after a mastectomy, okay? So that 00402 describes what happened here in this scenario, okay? So answer B is going to be the correct answer, okay? All right. So did you guys get that? Did you learn something? Let us know in the chat. And I'm going to move on. I have another scenario for you. And our answers are A, 00170 P1 modifier 99100, B, 00102 P1, C, 00102 P1 99100, or D, 00170 P1. A healthy 11-month-old with bilateral cleft lip and palate undergoes surgery. The surgeon performs a bilateral cleft lip repair, single stage. Code the anesthesia service. All right, I will give you a minute and a half, and your time begins now. Good luck. Okay, okay. I have a feeling you all rocked that. Go ahead and get your answers in if you haven't already. And just looking at my answers over here, I noticed that A and D have the same first listed code and B and C have the same first listed code. So probably be able to eliminate two of those pretty quickly. We have some P1 modifiers that are appended to each one of those codes. And then we have an additional code in A and C, 99100. So if we're familiar with this, we know that that is our qualifying circumstance modifier, okay? So let's go ahead and reveal the answer. Okay, our answer is going to be C. Okay, let's find out why. My keywords are healthy 11-month-old patient, bilateral cleft lip, palate, and then the surgeon's performing a bilateral cleft lip repair, and we're coding here for the anesthesia services, okay? So just need the code for the anesthesia services, and those are all anesthesia codes there. So we are in luck. Now, if we look at 00170, that's anesthesia for intraoral procedures, including biopsy, and that's for a procedure not otherwise specified, okay? But if we look down at 00102, that specifies the exact procedure that was done here. We have anesthesia for procedures involving plastic repair of cleft lip, and the surgeon here is performing a bilateral cleft lip repair. So that is specifying the type of procedure that's being performed. So we wouldn't use this 00170 code because we have a specific code to code for that anesthesia service, okay? So 00170, we can eliminate A and D. Okay, so we know that our anesthesia code is going to be 00102. Then we have that P1 modifier. Remember that P1 modifier is for a normal healthy patient, and it clearly indicates this is a healthy 11-month-old patient. So we would put that P1 modifier to indicate the status of the patient. That's in both answer B and C, but we have that additional code in answer C, 99100. And let's go ahead and look at that. Okay, that's our qualifying circumstance modifier, add-on code 99100, and that is for patients of extreme age. So if the patient is younger than 1 year or older than 70, and this patient is definitely younger than 1 year. Remember the great tip Mrs. J said, if you want to type in here, remember this is younger than 1 year, so it would be 11 months and younger. Our patient falls within that age range there, and so we would use that modifier 99100. That means B is incorrect and C is the correct answer. Okay, we got it, we got it. Okay, perfect. Okay, so let's go ahead and move on. I have another scenario for you. All right, here's our answers. We have A, 01952, P5, 01953, P5 times 5, 99140, B, 01952, P5, 01953, P5, C, 01951, 01952, 01953 times 4, D, 01951, 01952, 01953 times 5, 99140, modifier 51. A patient with a third-degree burn of 54% of his body is being treated under anesthesia for excision, debridement, and extensive skin grafting. The patient's condition is listed as severe, and he is not expected to survive without the operation. The operation is further complicated by the emergency condition of the patient, and delaying this procedure could lead to loss of body parts. How should the anesthesiologist report her services with this procedure? All right, coders, got a minute and a half, and your time begins now. You got this. Good luck. All right, get your answers in. I know we had a few more things to kind of sort out on this one. So while you're getting your answers in, I just want to look at these codes. And if I look at my answers here, I see in A and B, we have the same first listed, and C and D have the same first listed. So I just want to kind of look at those two codes first to determine the difference. Maybe we can eliminate a couple pretty quickly and then just focus on what we have left. Okay, our answer for this one is A. Okay, so let's go to our keywords. We have third-degree burn of 54%, anesthesia, excision, debridement, and extensive skin grafting, not expected to survive without operation, complicated by emergency condition, and we're coding here for the anesthesiologist. So it's really always important to know who you're coding for. Just in case we had some surgery codes here or something, we need to know who we're coding for. So we are only coding anesthesia codes here because we're coding the anesthesiologist. So we're in luck with these codes because they are all from the anesthesia section. And looking at the difference between 01951 and 52 came from the same code family. And if we just have, so we have to sort out what's going on, and those are for anesthesia, the family, the parent code says it's for anesthesia for 2nd and 3rd degree burn. We have a 3rd degree burn here. Burn, excision, or debridement with or without skin grafting, any site for TBSA treated during anesthesia and surgery of less than 4% total body surface area. So that 01951 differs from 01952 on the TBSA that we're dealing with. So 01951 is for less than 4%. And as you can see in our scenario, we had a total body surface area of 54%, okay? So definitely 01951 is not going to cut it. It's not giving us what we need as far as the body area that was burned. So we're going to go ahead and get rid of C and D, okay? So going to 01952, that's covering between 4% and 9% of the total body surface area. So that's giving us part of what we need, but we need to get to that 54%, okay? So we'll use that 01952 for our first code, but looking down at that add-on code, 01953, that's going to cover each additional 9% of TBSA or part thereof, okay? So let's just do some math here. 01952 covers the first 9%. Okay, so if we take that 54% that we had and we minus the 9 that we're covering with that first code, we have 45% left that we need to cover, right? So that 01953 covers each additional 9%. So we're going to take that 45% that we need covering and divide by the 9% that 01953 covers for each additional 9%, okay? So that gives a total of 5. So that means that we have to add-on code 01953 5 times to cover that remaining 45%, okay? So looking at our codes over here, we have that in answer A, okay? 01953 is being coded 5 times, okay? And that's what we need, all right? And if we look at, so we can go ahead and get rid of B because that's only coding 01953 1 time, okay? So that's not coding what we need for that to get to that 54%. So we can get rid of B. All right, and then looking at that P5, that is appended for a moribund patient who is not expected to survive without the operation, and it states in the scenario that without this operation, the patient will not survive or is not expected to survive. So we would append P5, and then that 99140, that's for anesthesia complicated by emergency conditions, okay? And it tells you there in the scenario that it is complicated by the emergency condition. Okay, so we would also use that 99140 add-on code, okay, the qualifying circumstance modifier. All right, so that gives us our answer A. All righty. Okay, all right, so go ahead and I don't know if you're taking a screenshot of this or you need to review it later. I know sometimes the ones that involve a little bit of math takes a little bit longer to process, I know for me anyways, that's true. But I'm gonna go ahead and move on. I have another scenario for you, okay? If you got that one correct, great job. All right, our answers here are A, 00320, 99100, B, 00320, C, 00326, or D, 00326, 99100. General anesthesia is administered to a 9-month-old undergoing a tracheostomy. Code the anesthesia services. All right, time begins now. Good luck, coders. Okay, get your answers in. I'm sure we probably didn't need that whole minute and a half for this one. This one's pretty straightforward. And again, looking at my answers, I have a split between these, between the first listed A and B, same first listed, C and D, same first listed, and then we have that 99100. We know that that's our qualifying circumstance code for the age. Okay, so our patient here is 9 months. So that's just some things to consider, and our answer is going to be C. Okay. My keywords here are general anesthesia, 9-month-old, tracheostomy, and we're coding again for the anesthesia services. Okay, so if we look at 00320, this is for anesthesia for all procedures on esophagus, thyroid, larynx, trachea, and lymphatic system of neck. So we have a procedure here on the trachea because it's tracheostomy. However, if we look down at the age, this is for age 1 year or older. So that might be something you just want to notate, that that is coding for a patient that's age 1 year or older. So some of these codes are age driven. That's why we always include the age as our, we just get in the habit of including the age as our keyword, just in case the code is age driven. This one is. So 00320 based off of age is going to be eliminated. Okay. So we can get rid of A and we can also get rid of B. Okay, going down to 00326, that is our anesthesia for all procedures on the larynx and trachea in children younger than 1 year of age. Okay, that's where we need to be for our age. I like it. Pay attention. Remember, you always have to look at the parenthetical guidelines. It tells us here, because typically you would report that 99100 for extreme age. However, it's telling us in our parenthetical guideline to not report 00326 in conjunction with 99100. Why? Because if you look up, some of these codes don't have the age listed. And in that case, if you're dealing with a patient of extreme age, you would use that additional code 99100. However, why would we need it if it already includes it in our code language? So it's telling you in the code already that this is for a patient or performed on a patient younger than 1 year of age. Okay, so our parenthetical guideline says do not use 99100 because it already includes it there. So that code would be eliminated, and that would be an answer D. Okay, and if we look up 99100, that tells, explains it again, the anesthesia for a patient of extreme age younger than 1 year or older than 70, and it tells us in a parenthetical guideline down there for procedures performed on infants younger than 1 year of age of time of surgery, see 00326. So these codes right here that it's listing are codes that are already going to include it in the code language, and you wouldn't use that additional code, okay? You wouldn't use that additional qualifying circumstance code. So we would get rid of D and we'll report C without that qualifying circumstance modifier, okay? All right. Everybody got that? Let us know in the chat. And I have another one for you. We're rolling right along with these anesthesia scenarios. You guys are doing great. Let's go for it. We have our answers here. 00567, 6 hours. B, 00566, 6 hours. C, 00567, 5 hours and 30 minutes. Or D, 00566, 5 hours and 30 minutes. Preoperative diagnosis, multivessel coronary artery disease. Post-op diagnosis is multivessel coronary artery disease. Name of procedure, coronary artery bypass graft ×3, left internal mammary artery to the LAD, saphenous vein graft to the obtuse marginal, saphenous vein graft to the diagonal. The patient is placed on heart and lung bypass during the procedure. Anesthesia time, 6 p.m. to 12 a.m. Surgical time, 6:15 p.m. to 11:30 p.m. What is the correct anesthesia code and anesthesia time? All right, coders, good luck, and your time begins now. Okay, all right, all right. Go ahead and get your answers in. How'd you do? Okay, so let's look at this. Again, I have a split. B and D, same first listed. A and C, same first listed. Okay, so that's going to be pretty easy to figure out. We have our answer here is answer A. Okay, and if we look at our keywords, we have our, remember, when we have a post-op diagnosis in the setting of a pre-op diagnosis, we code for the, we always just, we don't highlight the preoperative diagnosis as our keyword. We always go with our post-op diagnosis, okay? That's the definitive diagnosis there. Okay, so I'm gonna highlight that, multivessel coronary artery disease. We have heart and lung bypass. We have anesthesia time is 6 p.m. to 12 a.m. Okay, and we have another time there that I didn't highlight because that's our surgical time, and we're coding here for anesthesia. It's asking us for the anesthesia code and the anesthesia time, and so the anesthesia time here is 6 p.m. to 12 a.m. So that's what we are going to be coding for. Okay, all right, and okay, so sorting through these codes, 00566 is for anesthesia for direct coronary artery bypass grafting without pump oxygenator, and 00527, or sorry, 00567 is with pump oxygenator. So the question is, was a pump oxygenator used or not? So let's go and look at, oops, actually there was, sorry, my on clicks look like are off. So I'm getting rid of 00566, and I'll show you why in a minute. So B and D are going to be wrong, okay? And the difference, again, like I said, between those two codes is if a pump oxygenator was used or not, okay? So it doesn't exactly say it in our scenario, but you know that thing right here that says heart and lung bypass, that's actually what the pump oxygenator is. It's taking over the function, or it's performing the functions of the heart and the lungs, okay? So that is going to be the, pumping of your heart and the oxygenation of the lungs. So that is going to be the code that we're going to use, 00567, okay? And that's in answer A and C. And then it comes down to the anesthesia time. And if we look at 6 p.m. to 12 p.m., or 12 a.m., sorry, we know that that's 6 hours, but just for the visual learners, just putting it here for you all. So we have 6, 7, 8, 9, 10, 11, 12. That gives us our 6 hours there. So we're going to get rid of answer C, and A is the correct answer. Alrighty. We all good on this one, hopefully, and I think I have one more for you all. So if you're ready, here we go. We have our answers: A, 00400, QS, QX modifier. We have B, 00400, QS modifier. C, 00300, QS modifier. Or D, 00300, QS, QX modifier. A very large lipoma is removed from the chest measuring 8 square centimeters, and the defect is 12.2 centimeters, requiring a layered closure with extensive undermining. MAC is performed by a medically directed certified registered nurse anesthetist, or CRNA. Code the anesthesia service. All right, coders, you have a minute and a half and your time begins now. Good luck. Okay. Sorry for the ones who were waiting for the little pink bar to come up on the timer, but I think my on-clicks got a little out of order. So had to do it the old-fashioned way. So hopefully everybody got their answers in, and let's look at our answers real quick. So again, looks like we have a lot of these that have the answers that are split. A and B, same first listed. C and D, same first listed. And we have some modifiers here, QS or QX, okay? All right, so let's look at the keywords. We have lipoma, removed, chest, MAC, and CRNA, and we're coding for the anesthesia service. And our answer, there goes my timer. Our answer is going to be A, okay? All right, so let's find out why. All right, so looking at 00300, okay, and if you look up there at the heading, it's really important to always notice those headings. It's coding for the neck, okay? So it looks like we're in the wrong location there because here we are coding for the chest, right? So that's going to be incorrect, okay? So we can go ahead right away and get rid of C and D because we know we're coding for the chest. And looking down at 00400, this is for chest wall and shoulder girdle. And if we look at that code language, it says anesthesia for procedures on the integumentary system or on the extremities, anterior trunk. So your chest is the anterior trunk, okay? And perineum, not otherwise specified, okay? So that's I like that code. So between those two, that is going to be the right location, right? Between 00400 and 00300. So I like that code. Now it comes down to the modifiers here. If you look below that QS modifier, you can find this located in your HCPCS manual, and that is for the monitored anesthesia care service or the MAC that was performed, okay? So we definitely need to append that QS for the MAC, and oops, I think I went backwards here. Okay, and if we look at, and remember Mrs. J showed you some notations to place on your anesthesia page, and some of these were there, some of your most commonly used modifiers in this section. That's a great tip to write these out, okay? Because you do use this QS from time to time if it does say a MAC was performed. And also, your certified registered nurse anesthetist has a modifier as well. So that would be your QX modifier, okay? That indicates that a CRNA is performing this anesthesia, okay? And she's being medically directed by the anesthesiologist. Alrighty, so that would mean we're going to use both QS and QX modifiers. So we can get rid of answer B, and A is the final answer. Okay, so let me know how you all did. If you have any questions at all, feel free to type them in the chat. I'll be hanging out there while I hand it on over to the wonderful Miss Rochelle.
Thank you. Thank you so much, Miss Tracy. Wow, that was lots and lots of great scenarios. And listen, I think these coders enjoyed that, Miss Tracy. Okay, how are you doing, coders? Are you all ready? Because at this point, I think you're pretty good at anesthesia. So we're going to talk about radiology. So can you tell me what code series do we code radiology section from? Let us know in the chat. Yep, if you said 70, the 70,000 series, then that would be correct. Great job. All right, so let's talk about radiology and it's always best to start with our guidelines. So if you look on page 472, you will find your green pages there, and all of these guidelines would correspond to your radiology section, okay? So the first thing we're going to talk about is the separate procedure. So we pretty much know, if you've been following this class, we talk about this. Mrs. J specifically talks about this all the time, about the separate procedure. So just a reminder, yeah, a separate procedure are procedures considered, you will find this throughout the CPT section, and in pertaining to radiology codes, you will find them as well. And those codes, you will find them as designated as separate procedure. And whenever you find that in your code description, these codes should not be reported in addition to the code for the total procedure or service of which it is considered an integral component. So that means that that code will be bundled if it is integral to the procedure that's being done, okay? However, if the separate procedure code is carried out independently, that's going to be your code carried out, keyword carried out independently or unrelated or distinct from other procedures or services provided at that time, then you can code the separate procedure and you will have to append modifier 59 to it. Okay, easy, easy. Next, we'll talk about in your guidelines, you will find also the unlisted services or the procedures. Now, these are a list of unlisted procedures. You will find them. Also, don't forget that you also find these unlisted procedures, or actually, sorry, you will find them in that page 472, those unlisted procedures like so. Now, before you use this unlisted code, make sure first that there's not or there's no code procedure in that category 3 codes, because remember the category 3 codes list the codes for new technology, which is very common in radiology. Okay, so you have to look at your category 3 codes first. If they're not in there, then you can use the unlisted procedures on radiology section. Okay, so that's it. So I put an I in there just, so you can check it out when you have time. And then we'll move on to the special report. Now, anytime you use an unlisted procedure that we talked about just a second ago, those unlisted procedure would have to have a special report with them as well. Now, this special report should contain information that adequately defines or describes the nature and the extent and the need for the procedure and the time, effort, and equipment necessary to provide the service. So that special report will have to basically supplement your unlisted procedure for further information and documentation. Okay, so I have the I in there as well. And I think we're going to move on now to the administration of contrast materials. I think this probably is the most important guideline under this section. Now, when the code description says with contrast, just know that that is not referring to an oral or rectal contrast. Okay, they're referring to the contrast administered, and those are intravascularly, meaning to say the entry is into the vein. Also, it can be an intra-articularly, which means entry into the joint or into a joint, and intrathecally, which means the entry into the spine. Okay. Now, as you code for contrast imaging, you may also need to code an additional procedure, but make sure you watch for the parenthetical instructions under the imaging codes to see if other procedures should also be reported. Okay, now again, those contrast does not refer to an oral or a rectal contrast. So if you want to go ahead and put a little bit of note for yourself to remind you with that one for your convenience. And finally, another note here from your guidelines is the written report. So a written report is can be handwritten or electronic, signed by the interpreting individual, and should be considered an integral part of the radiologic procedure or interpretation. All right, so that's it as far as the guidelines. Go right ahead if you need to screenshot this for for later reference. And then I'm gonna move on to, I think, one of the most important things. Oh, there's one more thing I forgot. I always leave out one thing. We still have, as far as the guidelines, the supervision and interpretation. So basically, when you're coding for this radiology section, you may find that you will have to report 2 codes. Okay, one of them would probably be the surgical code. That code comes from the surgery section. These are the service code from the, or sometimes could be a service code from the medicine section. So that's going to be the coding for the surgery itself or the procedure. And then you will have to need that radiologic supervision and interpretation code from the radiology or the radiologic section. Now, these you will have to pay attention to your documentation and know that those cannot be confused by modifier 26. So there's a surgical code and you have your radiologic supervision and interpretation code from the radiologic section. So that's basically what it means as far as supervision and interpretation. So we call them sometimes as S and I. Okay, so go right ahead. And I know I got a little ahead of myself because I was looking forward to talking to you about the 3 Ps, as we call it here in AMCI. So if you have your copy for this one or screenshot, I'm going to go ahead and move along to the body planes. And the body planes, I think you guys know all about this. It's very helpful to know your body planes when you're coding for radiology section. So just know that the sagittal plane will be dividing the body into the right and left side. Okay, so you can see that pink going across the body there, and you will have your left side and your right side. Now you also have to know your horizontal plane. Now, a horizontal plane divides the body from top to the bottom, so upper side and the lower side, so it cuts through in the middle. Okay. Another one type of a body plane is going to be the frontal and the coronal plane. So the frontal plane, it divides the body in front section and the back section. Okay, like so. All right. And next, we're going to talk about the body positions. It helps us to code from this section as well, because this determines the approach or sometimes do. So there are several body positions. We have the prone, that would be a patient is lying face down on the front of the body. The supine is lying down on the back with your face upwards. Okay. You also have your lateral or right lateral recumbent and your left lateral recumbent. So a right lateral recumbent would be lying on the right side, and the left lateral recumbent is lying on the left side. And finally, you have this, what they call the supine. Well, it's actually called the folders, I think. I don't know if I said that correctly. Hopefully I did. But a folders position, it can be a low, semi, standard, or high folders. And usually this position is often applicable for patients who have cardiac problems or respiratory ailments or neurological issues. So basically a patient will be lying in supine position like so on the bed, which is inclined at an angle of 30 to 45 degrees, and that would determine whether it's high, low, semi, or things like that. Now, the other one here we call Trendelenburg position is basically they put a patient in a position where the head is lower than the feet and the body is laid supine or flat on the back at maybe 15 to 30 degree incline with the feet elevated above the head like so. And this Trendelenburg body position is basically they elevate the feet of the patient to improve blood pressure or low cardiac input. So very interesting, right? So if you like this image right here, go right ahead. Feel free to save yourself a screenshot so you can refer them for later. And then I'm going to go ahead and move along to, I think, probably the most important piece, the projections. So this is just, the entryway of the beam when they talk about say for example x-ray. So when they talk about AP, that would be antero-posterior. So that means that the beam of the beam would be from front to the back. Okay, so that's the passageway or the projection of the imaging. A lat or the lateral would be left to the right side. Okay. Posterior anterior would be, sometimes they call it PA, would be from the back to the front. So the the image goes from your back to the front. And finally, you have your oblique. This is the one which wherein the beam is going to be at an angle. Okay. Alrighty, righty. And then final thing we need to talk about before we move to the scenarios is going to be the radiology code. Sometimes our radiology code, as we all know, is a global service and it has several items bundled into it. Now, if you are a freestanding facility, you might want to pay attention to your documentation because sometimes these codes would involve a modifier. So again, if you are a freestanding facility and own or if you own the equipment, and then that means that you will no longer need to use any modifiers. So we'll have to be paid for both the professional service and the technical component of the service. So however, if you are, for example, if you're coding for a physician that's only doing as far as the professional services only, meaning this would pertain to be coded for doctors, radiologists that are basically just reading and interpreting the films, so they do not own the equipment whatsoever, just the service they provide in that radiology code is just a professional service only, then that's when you get to code or append the modifier 26 along with that radiology code. Now, if you are coding for the technicians, equipment, or supplies doing the technical service only, don't forget that you would also need to append a modifier TC along with your code. Okay? All right, and that's it for me. I think it's time now for us to do a little bit of coding challenge. Are you all ready? Ready? All right, so let's begin. So we have A 70554, B 70551, C 70555, and D 70554 with modifier 26. A 17-year-old male involved in a vehicular motor accident 6 months ago is experiencing neurological weakness, movement disorders, and sensory problems or sensory symptoms and blackouts. His neurologist has ordered a functional MRI to identify and map the stimulation of brain function to be administered by a tech in the office. The procedure will include test, selection, and visual stimulation. What is or are the correct procedural code or codes for this encounter? And I think you know the drill by now. I'm going to start your clock, and you may begin now and get your answers in a minute and a half. All right, coders, get your answers in. I bet you were faster than that a minute and a half there. Okay, so if you answered A, then you would be correct. If you miss it, well, let's go ahead and take another look at this. So as you know, we go over our keywords first. We have 17-year-old experiencing neurological weakness, and we have neurologist, a functional MRR, that's important, that's what we're coding for. We have MAP, stimulation of the brain function administered by a tech in the office. So if you look at these codes, first things first, we can eliminate the ones that we don't need. So looking at that 70551, that's coding for a magnetic resonance imaging. Now remember, it's very specific as far as our, the one that they did. They actually had a functional MRR. So this one here, imaging brain without contrast material, does not cut it. It's not the one, exactly the one we're coding for. So we can eliminate B. Now, magnetic resonance imaging for brain functional MRI, sorry, as you can see, is going to be coded under this family. So let's go ahead and take a look. I know I got a bit ahead of myself there, eliminating that 70554. And that is because if you look at that, 70554, okay, this is for magnetic resonance imaging brain functional MRI. That's your parent code there. It also includes, I have to just point out here that this is not requiring physician or psychologist administration. Now looking back, if you remember, our keyword there is telling us, or the documentation told us, that this MRI was administered by a tech in the office. And with that being said, you do not really necessarily need to indicate the modifier 26 there, because that's already included in the code description. We know when we use this 70554 that this one did not require a physician or psychologist. Okay, so I'll just stop right there for now, but I do have to point out another thing in a little bit. But I kind of want to go ahead at 50555, same parent code here. This one would definitely be wrong because this requires physician or psychologist administration of the entire neurofunctional testing, and that would make that wrong because, like I said, in our documentation, a tech administered that functional MRI. Now going back, also another thing here that really kind of nails it all down is your guideline there. If you look at your guideline, it's telling us here, when neurofunctional tests are administered by a technologist or other non-physician or non-psychologist, you have to use that code 70554. So that definitely confirms that we have to use the 70554, and that would eliminate your code 70555. Okay, and again, you do not need to use modifier 26 because that specific code is already indicated that in this code 70554, a non-physician or a non-psychologist administers this. Okay, so hopefully that makes sense. So your answer here is going to be A, 70554. If you got it, great job. If you learned something, that's even better. Okay, so are you ready? Let's try another one from this bunch. And I'll start with the answers first. We have A, 72050, B, 72040, C, 72020, and for D, you have 72052. A 37-year-old male presents to the ED with neck pain and trauma resulting from a motorcycle accident. A PA, and LAT or LAT and oblique x-rays were taken from the cervical spine. The ED physician confirmed the diagnosis of disc herniation and protrusion. What is or are the procedure codes for this encounter? And I'll give you a minute and a half, and you may begin now. All right, coders. Hopefully you did not see that little little surprise there. If you did, but you figured out, well, I had the correct answer anyways, then that would be great. I did had my on clicks were like in a wrong spot and it actually revealed the answer earlier. So if you missed it, the answer is A. If you got it anyways, well, good for you. Okay, so how did we come up with the answer? And there goes my pink bar. So we have a 37-year-old, and we're dealing with an X-ray here for APPALAT and oblique X-ray, cervical spine, and for disc herniation and protrusion. And if you look here, we are in the right place as far as your code series here. Well, we definitely have to know how many um, views are we coding for. So we have AP, PA, LAT, and oblique. That makes 4 views, okay? So if you look at 72020, that's your radiologic examination of the spine. This is for single views, and that would eliminate C because we need 4. So 72040, that's another radiologic examination of the spine, cervical. We like this so far because we're dealing with cervical spine, but this is only coding for 2 or 3 views, so that doesn't cut it. We need more. 72052, again same family, but this is coding 6 or more views. That's way too much. So if you look at 72050 for same pairing code, radiology radiologic examination, spine, cervical, 4 or 5 views. Perfect. Exactly what we needed because we only get to code 4. And that makes your answer A. 72050. And I know that one is so easy. So let's go ahead, try another one here. And I don't want to, I'm probably going to keep a timer for you guys because I don't want to spoil the answer. But as far as the answer choices, you will have A, 72129 with modifier 26, 74160 with modifier 26, for B, 74160 with modifier 26, 72192 with modifier 26, for C, 74178 with modifier 26, and for D, you have 74177 with modifier 26. A 67-year-old female arrives to the ED with complaints of stomach pain, fever, nausea, and vomiting. A CT scan with contrast of the abdomen and a CT scan of the pelvis without contrast were ordered. The abdominal scan showed inflammation at the splenic flexure and the pelvic scan was inconclusive. The ED physician diagnosed the patient with diverticulitis. What are the procedure codes for the professional services? And I'll give you a minute and a half, and I'll do it the old-fashioned way just to make sure. And coders, your time begins now. You can do this. Alrighty, righty, get your answers in, coders. Are you ready? All right. Let's reveal the answer. If you look, this one actually is doing the right thing. Oh, sorry, went too far. Okay, so the answer is going to be C. So if you got it, great coding. If you missed it, well, let's find out how we came up with the answer. So we have a 67-year-old CT scan with contrast of the abdomen. We also have a CT scan of the pelvis without contrast. Okay, those are the two things we need to code for. And we're coding for the ED physician, and the diagnosis was diverticulitis. So looking at these codes, you have 72192. Let's take a look at that. That is coding for your CT of the pelvis without contrast material. And that would be actually true, right? We had that procedure as far as our documentation. So hold on to this thought, okay? If you chose 72192. Also, the 74150 is for the CT of your abdomen without contrast material. Exactly also what happened in our, well, actually for this, the CT contrast for the abdomen was with contrast. So 74150 would be incorrect. But we are looking at 74160 actually. Let me see where my own clicks are not there. But I'm referring to the 74160 with contrast for the abdomen, okay? However, it doesn't really matter because there's really a guideline that we have to follow when we're coding for combinations of the CT, of the abdomen and the pelvis. It will come from here. You actually are given a chart as well. So if you look, it's telling us here the guidelines is telling us that if you have a combo of CT of the abdomen with the CT of the pelvis performed at the same session, you cannot code or do not report more than one CT of the abdomen or the CT of the pelvis for any session. So you only get to code one. And that is why you get to be, you are provided for this chart here so that you only get to pick one depending on what you are dealing with. So how do we do it? Okay. So if you look, oh, actually, because of this guideline here, I'm going to go right ahead and eliminate A and B. So then we can focus on that one answer. Okay. So everybody okay with this one? So I had to eliminate A and B because based upon this guideline is telling us that you cannot code more than one CT codes when it comes to abdomen and the pelvis. You only get to code one. So A and B is eliminated. And then you have to focus here. So your standalone code, the CT for abdomen with contrast is going to be code 74160. And then you look at the column there, you will have to find the pelvis one. So um, what radiologic or what code is for your pelvis? That was like horrible. But I would say this one here, just look here in this horizontally, that would be your abdomen codes here, and here your diagonally would be your pelvis code. So as far as our abdomen, we had a CT, abdomen with contrast, and for your pelvis, you had contrast. Is that correct? Okay, so what you're gonna do is just go right ahead and pick the one in the middle. So you know that this is CT abdomen with contrast with CT pelvis without contrast. So your code there is 74178. Okay, and if you also look at it as far as the code description, you will find 74176. That is your pairing code, computed tomography of the abdomen and pelvis. See, those are in the same exact location, both for abdomen and pelvis. This one, the parent code is without contrast material, but we're coding here 74177 is with contrast material, which would be eliminated because we know that there's two things going on. For the CT abdomen and pelvis, one was without contrast material and the other one followed by contrast material. Okay, so exactly the same description as what happened, but only thing is we only get to code one code, and that code would have to be 74178. And don't forget your modifier 26 because we are coding for the professional services only for this particular encounter. Okay, so that makes your answer C. And don't forget to read all these do not reports here. Really important that you follow them. But I think we solved this scenario. So how do you feel about this one? You got it? You missed it? Well, if you missed it, hopefully you learned something. And if you're ready to move on, I have one last scenario for you guys as far as in this section. So we have A 77065, B 77067, C 77065, and D 77066 and 77067. A 47-year-old female with a history of fibrocystic breast disease presents to the mammography suite for screening of bilateral mammogram. The radiographic images are further processed using a computer-aided detection with digitization, I can't say the word, of the images. What is or are the procedure codes for this encounter? And I'll give you in a minute and a half. And when you're done, please put your answers in the chat. All right, coders, get your answers in. You ready? Okay, look, my tab did not work again. I love this tab, but sorry I keep messing it up for you guys today. But as far as the answer, yes, if you answered B, then you would be correct. So we have a 47-year-old history of fibrocystic breast disease. We're coding for the screening of bilateral mammogram, radiographic images, computer-aided detection with digitization. Okay, so we're coding for that screening of bilateral mammogram. If looking at your answers here, you have 77065. That is for diagnostic mammography, including computer-aided detection. That's for CAD and unilateral. So that one, a lot of ways that's wrong. That would also eliminate C. If you look at 77066, on your answer D is for bilateral, but remember this is for diagnostic mammography. We're looking for screening for bilateral mammogram or screening for mammography, which you will find in your code 77067. You have your screening mammography there, bilateral. So you do not even need to add modifier or anything at all. This is 2-view study of each breast, including the computer-aided detection, your CAD. So we have that in our documentation as well. So everything is, all the description matches here. So your answer is going to be B, 77065. So great job, coders, if you got that right. And hopefully you enjoyed that little presentation there. And at this point, I think it's time for me to turn you back over to the amazing Mrs. J. Are you ready, Mrs. J?
Absolutely not. That was incredible. That was, one of our longer sessions. Outstanding. Outstanding.
Thank you, Mrs. J.
Outstanding. And hopefully, some of them were doing an amazing job in the chat. I hope they learned something. And you
I
know
have a
what?
good feeling. And I'm sending you the screen, Mrs. J.
I have it. Awesome. Thank you. All right. So I'm sorry you were saying, Ms. Rochelle.
Oh, no, I was just saying, Mrs. J, are you ready for me to unmute the screen?
Okay,
Thank
I
you,
was
Mrs. J.
stalling. Thank you. Thank you so much, Ms. Rochelle. That was amazing. A great presentation on the radiology. Good review of the guidelines. And so I think I can just kind of end things up by speaking about radiation therapy. Radiation therapy or radiotherapy, often it's denoted with the abbreviation RT, RTX, or XRT. And this is therapy using ionizing radiation and generally a part of cancer treatment. So as you can see in the image, this young lady may have breast cancer. I would hate to say that, but this is an image of radiotherapy or radiation therapy. Now, when you're coding for radiation therapy, you've got two things to consider. Are we coding for radiation treatment delivery? Pretty much, this is the technical component. Ms. Rochelle spoke about the technical component, distinguishing the two. Just to review it again, technical component, that is the equipment, the facility, all things owned by the facility. There you go, or the facility owner. So that's your technical components. Radiation treatment delivery. However, when we're coding for radiation, often you'll see the radiation treatment management. This is where we're coding the most, and this is where there are the most guidelines, and these are your professional component. So this is actually the administration of the therapy. So the professional services for the administration of therapy. Now, I have an image in front of you, and this image comes from CPT, Principles of CPT. Did a fantastic job supplementing the CPT and further clarifying the CPT. So if you are able, I would encourage you to buy it. A lot of examples and additional practice. So the radiation, this image comes from Principles of CPT Coding by American Medical Association. So what is involved with this radiation treatment management? Well, we know, because it's written in front of us, what's bundled are the review of the port films, review of dosimetry, dose, delivery, and procedure parameters, review of the patient treatment setup, examination of the patient for medical evaluation and management. Example, assessment of the patient's response to the treatment, coordination of care, review of imaging and or lab test results. So this is where some people say, hey, this is really difficult to code, and it's not, and I'm going to show you. There is a guideline when coding for radiation treatment management. If the patient receives 5 treatments and then receives an additional 1 to 2 fractions, you do not report the additional fractions. Only if 3 or more fractions beyond the original 5 that are delivered would you report 77427 to indicate the additional treatment management. All right, so you know what, coders? I'm going to take you to the guideline. I'm also going to take you to this little chart in your CPT manual, and let's go ahead and let's read it. All right, so here are your guidelines. This code 77427 is also reported if there are 3 or 4 fractions beyond a multiple of 5 at the end of a course of treatment. 1 or 2 fractions beyond a multiple of 5 are code are not reported separately. And I like this chart here because it kind of tells you how to use the codes. You got 77427. This is your typical treatment management code for 1 to 5 treatment. And then 77431, this is your treatment management code for 1 to 2 fractions. And you know what? A fraction is a portion of a treatment, so they're used interchangeably, all right? And that's pretty much it. And so I know you're saying, Mrs. J, how dare you give us this information and not explain it? Well, coders, the best way to explain it is to give you a scenario. How about that? All right, I am stalling because I want you to read too. You know, I want you to get ahead. We only give you a minute and a half. All right, I'll read the answers first. A, 77427, 77431. B, 77427 times 2. C, 77427 with a 26 modifier. And D, 77427 times 2 with a 26 modifier. A 53-year-old male presents with small cell lung carcinoma and a 40-year history of smoking dependence. He has an 8-centimeter mass spanning both the lower and upper left lobes. The patient undergoes concurrent chemotherapy and external beam radiation for a total of 9 treatments during his management period. Upon completion of treatment, a detailed review of all clinical, technical, and laboratory findings, as well as a complete physical exam of the patient, was carried out for treatment management. What is or are the procedures for the professional services for this encounter? Okay, coders, you have a minute and a half. Okay, coders, I'm going to refresh my screen because I did make a change. Just had a little change that I needed to make. And I'm going to show you the screen in 5, 4, 3, 2, 1. All right, so what did you say? What is the answer? Yeah, let me make sure I'm... 1 second, just want to make sure. Okay, so what did you say, coders? If you said B, outstanding. Yes, B is your answer. Now, let's look at how I solved it. As you can see on the right, I've got my chart and I have my codes. My keywords are 53-year-old with a history of smoking dependence. He had an 8-centimeter mass and now chemotherapy and external beam radiation took place, and this patient had a total of 9 treatments. During his management period, had a detailed review of all clinical treatment and laboratory findings, as well as the complete physical exam. Remember, coders, all of this is bundled in radiation treatment management. So if you want to go back and take a look, all of these services are rendered. Now we are coding for the professional services. And remember, the radiation treatment management is a professional component. So that code in itself is a professional component. So if I say that, knowing what you know because you are advanced coders, you know that you would not need to append a professional component modifier at the end. So on-site coders, what are we eliminating? C and D on-site. And if you look at your chart, there's your reminder. They're telling you what's your technical component and what your professional components are and so forth. All right, so I digress. I'm coming back. Now let's look at our codes. We have 77427. This is a good code because this is the code for radiation treatment management. 5 treatments. Yeah, so this is great. However, and we know 77427 will cover 5 of the treatments, but we have a total of 9. So let's look at what's going on here. We know we can use 77427 for 3 to 7 treatments. And if you want to write that down next to your code, you can. Covers 3 to 7 treatments. That's what all that language was in that guideline. And 77431, oh, I thought I put it there. It should say 2 and under. Hey, I guess it didn't register. That's why I hid my screen, so I can fix that. But 2 and under, 2 treatments and under. So if we look at 77427, this is 5 treatments, and we go to 77431, because we've got a total of 9 treatments, can we go to 77431 and get the rest? Well, no, because if you remember, 77431 is for 2 and under. And let's look at this. It says for radiation therapy management consisting of 1 or 2 fractions only. That's it. So 1 or 2 fractions only. You're not gonna append this 774 or code this 77431 with anything else because that only. And if you look at the parenthetical guideline right below, it says 77431 is not to be used to fill in the last week of a long course of therapy. Look at that. It is not to be used for that purpose, and 77431 is incorrect. And boom. And you know what, coders? If you followed that clue that a lot of you already knew, that professional component, you would have eliminated C and D, and you know what? You would have answered your question. You would have gotten the question correct and moved on to the next. All right, so we know that 77427 is not coded because you do not append a 26 modifier on 77427 because it is a professional component itself. And that's the same with D. You don't append 26 modifier on a professional component, a code that is a professional component. So coders, if you said B, outstanding, great job. All right, so I think we've got one more, and then it's time to go. All right. I'll read the answers first. A, 74183 with a 26 modifier. B, 74181, 74182. C, 74182 with a 26 modifier. 74181 with a 26 modifier, and D, 74183. A 37-year-old male patient presents to the hospital's radiology department with a renal mass. He will undergo an MRI of the abdomen for analysis of the mass. In lateral position, MRI scans were taken without contrast. Then a subsequent scan was performed with contrast. What is or are the procedure codes for this encounter? All right, coders, I'm going to give you a minute and a half. Okay, I'm back, coders. How did you do? What did you say? If you said D, outstanding. All right, let's go ahead and solve this. Our keywords: 37-year-old, radiology department, renal mass, MRI, abdomen, lateral position, MRI scans, without contrast, subsequent scanned, performed with contrast. Okay, coders, you know that we're coding for an MRI scan, and we know that when we're in that radiology section, we have two. When it comes to coding contrast, you have without contrast, you have with contrast, and you have without contrast materials followed by with contrast materials. So this is the case that it is a with and without contrast in the same encounter. So we know that there is a special code for that. So I'm going to treat you like the advanced coders that you are, and we're just going to just bypass all of the nonsense. The nonsense is giving time and credence to something that we know is incorrect. So 74181, this is the code for without contrast. We're not going to code that because we're going to code the bundled one. We're going to code the 74183 that has both. All right, and 74182, we're not going to use that either. We're not going to code these separately because guidelines tell us that we need to use the code that encompasses or embodies all. So that leaves us with A and D. And the difference between A and D is A is coding for the professional component and D is coding for it's the global code, everything. So what we know is A is coding for the physician and D is coding for the facility. And guess what, coders? There is no mention of any physician. None. No professional services. But what we do see is a radiology department. We know that this scan took place. And we know it was with contrast and without contrast, and there is no mention of a professional or professional services. So A is incorrect, and D is our answer. Okay, coders, if you got that correct, outstanding. But if you learned something, that is priceless. And remember that. And before we go, I'd like to share with you some of the CPT, principles of CPT resources. This is found in the radiology section of that text. It's a fantastic text. And if you're able and you need more, this is it. This is what I endorse. Okay. Also, want to remind you next week we'll be delving into pathology and laboratory. I like Path and Lab a lot because it really, every time I'm in there, I find something new. So it'll be a great time next week. And if you want to win the AMCI lecture series, make sure that you comment on the video below this video. Tell us what you learned today and sign up for the link provided, and it's in the description, and we will announce the winner at the end of week 10. So do this week, week 8, do it week 9, and we'll announce the winner at week 10. And if you don't want to wait for this drawing, feel free to just go ahead and purchase it right out. The lecture series is extremely affordable, and you get an additional 10% off. There's a coupon in the description, so take advantage of it. All right, now we're talking about, we're almost finished with this section, so we're moving on and we're talking about what to do next. All right, coders, let us know. Would you like us to offer ICD-10-CM, ICD-10-PCS, HCPCS Level 2 modifiers, or something else? Go ahead and write it in the chat if you're here with us live. If you're not here with us live and it's after the fact, go ahead and post it right below this video. All right. If you have questions, if there's something that I didn't answer, or any of us, if it's something we didn't answer for you and you need a little more, contact us at customer service. We can be reached at www.amcicoding.com, or you can type in that long address, www.absolutecodinginstitute.com, and click on contact and say, hey, I have a message for Mrs. J, Ms. Tracy, or Miss Rochelle, and we will be sure to get back with you. All right, Mrs. Tracy, please, if you are available, take yourself off mute. I think Miss Rochelle stepped out for a moment, and I want to remind you, if you like our instruction, please like this video. Tell everyone about us. The more people watch, the more videos we can make.
Yes, woohoo. That was a great discussion to end the class, Mrs. J. Radiation treatment management. Thank you for the breakdown of that, and thank you for a wonderful class. I think this was very solid. Coders, you did an amazing job today. Thank you for coming out here and joining us.
They are. You guys are outstanding, amazing, and thank you for making it worthwhile. You do. You encourage me every week, and I thank you for that. And thank you, Ms. Rochelle and Mrs. Tracy. And don't forget about you all, my instructors in the chat. You guys, no words. No
They're
words.
always rocking it. They're
Awesome.
incredible. Yes, they are.
Okay, everyone. Have a great day. Thank you.
Thank you so much. See you next week. Bye, Mrs. J. Bye, coders.